We're sitting in southwest Franklin County today talking with Brian Stroh, who is the doctor and CEO and medical director for NetCare Access, a leading 24-hour mental health and substance use crisis intervention and assessment provider in Columbus that's been here in Franklin County since 1972. These are the folks that offer all kinds of services for adults and those with developmental disabilities. And the cool thing, gang, is they provide care regardless of an individual's ability to pay. So welcome to Columbus Perspective, Brian. Thanks for being with us today.
Thanks for having me.
So when you think about all of the different areas of service that you provide, what is the area that gets the most attention?
We provide mostly crisis services. So we do provide some ongoing care, but most of what we do is centered on those who are, frankly, having their worst moment. They're at the worst time of their lives and they need somebody to step in now.
And when you talk about that worst moment of their life, that's not necessarily confined to one subject matter.
No, they're usually tangled in each other. It's really rare that we meet somebody who has, say, a mental health problem and no other health problem going on, no other problem going on in their lives. It's rare that we meet somebody who is in the throes of addiction who has no other problems going on in life. These problems build on themselves really rapidly.
How does an individual know, or how does a support person for an individual, like a spouse or a mother or father, a family member, even a coworker, how do they know when there might be a problem?
So I think it depends on what you mean by problem. Let me start with the more obvious thing, which is crisis. We define crisis as someone's in imminent danger to themselves or others, or they're so severely affected by whatever's going on that they lack the ability to take basic care of themselves. So if that's crisis, a problem is something that doesn't quite rise to that level, but still impairs functioning. And we look at all the realms of that. If there's an impairment of family function, work function, school function, legal problems, there's lots of different realms that tend to trip people's trigger, for lack of a better word, and say, I wonder if there's something going on with this person.
National statistics show that people are reticent to come forward when they're in crisis, even when they may perceive they have a problem. Why do you think that is?
I think it's multifactorial, actually. We have hundreds of years of stigma behind mental health and substance use, and that tends to get in people's way very, very quickly. The other thing is that there, in particular mental illnesses and in substance use, we run into what's called lack of insight, which is people are robbed of their ability as a result of these conditions to understand that something is wrong. We treat people every day who it's very obvious that they're not thinking clearly. It's very obvious that they're, say, suffering from hallucinations or delusions. But if asked directly, do you have any mental health concerns right now, will absolutely tell you that they're fine.
When you have a situation like that, how often does it impact multiple members of the family?
Almost always. It becomes an issue quickly when people who are trying to help this person don't get anywhere or don't get far enough. It becomes an issue when, again, those danger factors enter into it, and now the people around them are incredibly concerned. And the other thing is that that's assuming the person has a good support network around them. A good number of the people we take care of don't have a support network around them, and they are reliant on kind of public safety and other entities to take basic care of them. So it gets complicated pretty quickly.
And when you say support, the first thing that comes to mind is just someone who cares, somebody who pays attention. But in certain cases, that may do more harm than good. And I'm talking specifically about the concept of helicoptering, where you are either overprotective of a spouse, a child, a coworker, a subordinate, and you're actually exacerbating the problem.
Yeah, it's interesting. We for years, we've seen changes among generations about how people are. I'm going to use parenting for a moment as the most direct example. They're only half jokingly will millennials tell you, my parents told me to go out and do something during summer days and don't come back until the street lights are on.
I went through that.
Meanwhile, with the evolution of, we have 24-hour news cycles that are forever pushing violence and danger in our faces, which changes our barometer on how safe the world is. We have technology that lets us figure out where people are every single waking moment. We have video cameras that trap everybody who crosses our sidewalk, or I shouldn't say trap, who tape everybody who crosses our sidewalk. We are a very aware society, and that changes people's threshold for what they worry about. And that's not always great.
We have a problem in Franklin County with teen suicide. And it starts with a problem or a circumstance at the home, something that may or may not have happened at the school, which may or may not have been handled properly, bullying, and it leads to behavioral choices that, here's our favorite word again, exacerbate the problem. To what degree do you work with teens, and how do you help them?
So because we're a crisis provider, we never say no. There's a now longer standing concept in crisis behavioral health called no wrong door. I'm not here to tell you you did the wrong thing, you called the wrong number. If you need help, you need help, right? We don't have people call 911 and say, I need an ambulance and get punted to another number. We just take care of the problem. So we strive for that. There is still in Ohio some bifurcation, though, of services for kids and young adults compared to non-young adults, for lack of a better term, kids who are no longer in that transitional window. We as an agency will always address what's at hand, but unfortunately there do remain some divides there that we're here to bridge, but that we can't make go away entirely. To your question about teen suicide, we have a teen suicide problem and then we have a writ large suicide problem. They're both there. I think we understandably hear it as more tragic when somebody young dies by suicide. But at the end of the day, we have a problem writ large that gets magnified under certain circumstances.
To what degree have changes in school policy and government support or lack thereof for sexuality issues, to what degree has that made that problem so much worse?
Yeah, I think we are in an era where, luckily, young folks feel more free to express what they think is going on with their orientation or their gender identity earlier in life. And all the data indicates when we do studies and we look through other academic avenues that is to the good. But what it does is it makes institutions that are traditionally not in those roles responsible for them. So, for example, if a kid goes to school at age 13 and comes out, now the school does have some onus there, right? There is the potential for bullying. There is the potential for any of a number of things. So the fact that folks come out earlier does mean now that it spans systems. And each of those systems has partial responsibility, but no one system can handle all that alone.
So that being said, and this isn't a problem that's unique to our time. We've always had generational disagreement about culture and values and how we live our life. But given that the individual has tethers to so many different places, the school, a religious institution, the sports team, what happens at one parent's home, perhaps another parent's home, perhaps the grandparents are involved. To what degree does some sort of group counseling exist, or is that just asking for too much to herd the cats?
I think the way that usually gets resolved is because there's, again, this dichotomy of behavioral health care for youth and for adults. When you think about it, what you're mentioning is mostly a situation of the young, right? As we get older, we get more self-sustaining. So it is pretty common for youth behavioral health providers to do exactly what you're mentioning, which is get all these sources drawn together and say, can you help me get a bigger picture of what's going on with this youth?
What do you do for people, whether they be a young person or an adult, who don't feel comfortable physically coming in for help, but like the safety of operating behind a computer, a mobile device, maybe not even wanting to orally engage, but want texting? What do you do for those folks?
Yeah, that's a huge shift, and you're right. We see that generationally. This is the first generation, when you look at it, that grew up entirely digital. They don't understand the analog world nearly as well as older folks do. For us, we meet that need a few different ways. So we do telehealth for our outpatient clinic, and we actually have a significant number of people who avail themselves of that pretty regularly. When it comes to our crisis lines, we now serve all of those, or I shouldn't say that, let me back up. When it comes to our crisis lines, we have text and chat services available on a good number of them. So, yep, you can call those numbers if you want to. You can also text or chat 988, and we're watching the numbers there explode.
Back to the beginning of our conversation, in the introduction, we said provide care regardless of an individual's ability to pay. How do you know what an individual's ability to pay is, and what do you accept if there is an ability to pay?
Sure. So the community mental health system is kind of its own entity, and this came from deinstitutionalizing people in the 60s and the 70s. And the idea was the government would spend less money keeping people in hospital for the rest of their lives and put more money into treating those folks as outpatients once they were released. So that gave rise to, in Ohio, that gave rise to the ADA boards, the Alcohol, Drug, and Mental Health boards. And every county in Ohio has a alcohol, drug, or mental health board. Some of them combine together to form boards that cover multiple counties. Here in Franklin, we have a singular board. But those boards are in charge of distributing public funds to take care of those who cannot pay another way. We have income scales that's judged by, and frankly, in the age of Medicare and Medicaid, it often boils down to, do you have those resources or not? Our patient population in particular, if they don't have those resources, almost always tend to qualify for Adam paid services.
But let's say somebody has the ability. Do you accept standard insurance?
What we do in this particular case is we say, we will provide you services, and it's up to you to submit the claim to your insurance company.
Okay, so they pay you, and then they get reimbursed by their provider. What is the biggest challenge that Netcare Access faces in 2026?
I think our biggest challenge right now is the uncertainty in the nonprofit space. We are watching seismic shifts at federal and state levels as to what nonprofits are responsible for, what they're not responsible for, and who's going to pay for what. And I hate to boil it down to money, but money is what makes these services go. And so we have been fortunate so far to be able to roll with the punches, but the sector writ large can only take so many punches.
What percentage of your budget is funded by federal, state, county, local funds?
Literally all of it.
Okay. So if, God forbid, there was a dramatic change and suddenly all of that funding were to go away, you would have to close your doors.
Absolutely.
What can you tell people as we wrap up this segment, the best way for them to help those that they care about?
I think the best way is to, it sounds really juvenile, but keep an eye on each other. We have a tendency in society today to say, oh, I want to avoid that. I don't want to get my nose in that. I don't belong there. The best thing we can do is show that we care. Let me give you an example. There's an oft-repeated myth that if we ask folks if they are experiencing suicidal ideation, we'll suggest it to them, we'll make them think it. The data shows absolutely the opposite, which is that when we ask about that particular thing, we give relief to the person who's already thinking that, because they're not left thinking, oh my God, this is just me and I'm on my own and there's no one to help.
We want to thank Brian Stroh for being with us today, and for Columbus Perspective, I'm Jay Fox.